Perkenalkan, nama saya Fatimah Ismi Nurhandini, NIM 419014.
Perkenalkan, nama saya Fenuji Astuti, NIM 419015.
Perkenalkan, saya Friska Nanda Aprilia, NIM 419017.
Perkenalkan, nama saya Sinta Dinda Justika dengan nomor NIM 419018.
Perkenalkan, saya Fitri Aulia Salsabila, NIM 419016.
Perkenalkan, nama saya Ida Fadilah, NIM 419019.
Perkenalkan, nama saya Lajinatul Mahmuda, NIM 419020.
In order to understand calcium channel blocker, we need to understand calcium and its role in the body. When you think of calcium, think of muscle contraction, think of excitability. Calcium channels are important channels in our body that allow the movement of calcium in and out cell or cellular organelles. There are two main calcium channels we will talk about, and these are the T-type calcium channels and L-type calcium channels. Calcium channel blocker. But what this drug do is that, as the name suggests, they block calcium channels. More specifically, they block T-type calcium channels and or L-type calcium channels. So there are L-type calcium channel blocker or T-type calcium channel blocker. It's important to know because these channels are found in different parts of our body. For example, in the heart, going back to our pacemaker cells, which control the heart rate, there are T-type calcium channels. Calcium activity in the pacemaker cell causes the heart to pump faster and so contributes to increasing the blood pressures.
Think of the typical calcium channels as time 24 time because the pacemaker is filled up to heart control the heart time, the heart rate. And so by using the typical calcium channel blocker, it will take calcium activity and thus decrease heart rate, decreasing correct output, and then decreasing blood pressures. This might get confusing, but prior to the types of the typical calcium channel blocker, there are the phenyl alkylanes such as verapamil, the benzodiazepines such as diltiazem, and not hydropyridines such as the ones that end in the pen. So they are all different, but to put it simply, they just work differently and they also work on the typical calcium channels but anyway. So for example, here is verapamil, a common-counting channel blocker which will block the typical calcium channels on the pacemaker cells.
Let's talk about the L-type calcium channel. We are found on smooth muscle cells, so here we have the blood vessel, which as we know contains smooth muscle, and here is the limit of the vessel. For example, the L-type calcium channel allow influx of calcium into the muscle filament, which will cause contraction. This will increase the blood pressure, because it causes the vessel to contract and become more narrow. But there are some channels are also found in the cardiomyocytes, and thus they will increase the power of contraction of their cardiomyocytes, which will further increase cardiac output and so blood pressure. L-type calcium channel blocker are the dihydropyridine with that end in the beam. Some of the drugs from dihydropyridine also block T-type calcium channel, and so is also part of the T-type calcium channel category. A common example of a L-type calcium channel blocker is the Philippine side effect of the dihydropyridine, like a lot of antihypertensive are causing high dizziness from hypertension, palpitation, and peripheral edema. Contraindication of calcium channel blocker are congestive heart failure, heart block, hypertension, and ventricular tachycardia. And this is unique to calcium channel blocker because in heart failure, the heart is trying to compensate by contraction a lot harder, and so if you use HC1 channel blocker specifically on L-type